2019 novel coronavirus disease, commonly known as COVID-19. This presentation is being brought to you today by San Joaquin County Human Resources Risk Management Department. This presentation is dated November 2020. Please understand, as you undoubtedly know, this virus, COVID-19, we've seen updates and changes regularly. Therefore, at the end of this presentation, there is a link to the website for both the Center for Disease Control and Public Health Services for you to get the most recent updates to COVID-19. Our objective today is to discuss what is COVID-19, sources of exposure to the virus, hazards associated with the exposure, how to protect yourself, what to do if you get sick, and personal protective equipment. COVID-19 is a respiratory illness in humans caused by a new novel coronavirus. Coronaviruses are large families of viruses. Symptoms of this new virus can include, but are not limited to, fever, cough, shortness of breath. 80% of individuals that contact this virus will not have severe symptoms. However, 20% of individuals that contact this virus may suffer from severe symptoms, which can cause pneumonia, respiratory failure, the need to be in ICU for care and treatment, the worst outcome, death. Symptoms may appear 2 to 14 days after exposure to the virus. Exposure. How do you get coronavirus? Your exposure is to being around someone who has COVID-19 within 6 feet of that individual for a cumulative total of 15 minutes within 24 hours. What does that mean? That means you spent 5 minutes here, 3 minutes here, 8 minutes here, 5 minutes here within a 24-hour period. It is very, very important that you practice social distancing when in the workplace, when out in public. Practice social distancing. You should not be within 6 feet of any individual. Exposure time frame is up to 2 days prior from the date of symptoms onset or up to 2 days prior of when the employee was tested. Social distancing and wearing your mask, personal hand hygiene are going to be your best prevention options. How is the virus spread? Person-to-person spread through respiratory droplets produced when an individual with COVID-19 cough, sneeze, sing, talk, or breathe. They may produce respiratory droplets. If you're within 6 feet of that person who has COVID-19, you can have an exposure. Droplets can land on your mouth, nose, or eyes, or be inhaled into your lungs. You can also contact this by touching surfaces or objects contaminated by the virus and then touching your mouth, nose, or eyes. Person to person is the most likely way of obtaining the virus. Public health response. How is public health helping us with this? Because at the current time, there's no vaccine to prevent COVID-19. So public health and guidelines tell us, wash your hands often. Wash your hands with soap and water for 20 seconds. 20 seconds, you can sing the happy birthday song in your head twice, and you will be at 20 seconds. Wash your hands thoroughly. Wash between your fingers. Wash your fingers. Wash your wrists. Soap up really good. If you cannot use soap and water, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your cough or sneeze with a tissue. Then throw the tissue in the trash. Avoid close contact with people who are sick. Keep in mind, some people that are positive for COVID-19 may not have symptoms, so you may not know that they're sick. Therefore, practice social distancing. Assume that everyone that you come in contact with in the workplace and in public may be positive for COVID-19. With that assumption, maintain social distancing. Make sure that you clean and disinfect frequently touched objects and surfaces. In your departments, there will be signage, flyers, posters telling you about social distancing. There will also be cleaning stations set up for you. Your department has got cleaning solutions and hand sanitizers, paper towels for everyone to participate in regularly cleaning frequently touched objects and surfaces. If you're sick, stay at home. Remember, standard infection control measures, personal hand washing hygiene, cover your cough, stay at home if you're ill, and clean surfaces. Non-pharmaceutical interventions, commonly known as NPIs, include personal prevention and environmental. Personal measures that you can take to avoid contact. Social distancing to keep people who are sick away from one another. And environmental factors include cleaning, wearing face coverings. It is mandatory that you wear face coverings when you're in contact with other individuals, in the workplace, in the public. Wash your hands for at least 20 seconds, and when you cannot wash with soap and water, use a hand sanitizer that has at least 60% alcohol. For more information on hand washing hygiene, the CDC website is right there for you. Make sure that you cover your mouth and nose with your mask. Make sure that it fits snugly to the sides of your face. Do not touch your mask while you are wearing it. If it is not fitting properly, get a different mask or adjust that one to fit properly so that you're not touching it. If the mask gets wet, torn, or damaged, it's time to replace it. Remove your mask by your ear loops or ties. Do not touch the front side. At the end of this video, there will be 2 websites that you can go to that will show you the proper donning and doffing of both gloves and masks. When you're reviewing the mask, make sure you pay attention to the proper way to remove and put it on. When you're reviewing the glove presentation, the person that's doing the demonstration does make a mistake by putting on her gloves and then touching and contaminating the glove, touching the doorknob. I want you to pay attention on the proper way to put on and take off your gloves and your mask. And a reminder, the CDC guidelines tell us do not use a face mask meant for healthcare employees. CDC also reminds us that cloth face covering should not be placed on children under the age of 2 or anyone who has trouble breathing, who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Cloth face coverings or masks are not a substitute for social distancing. Even when social distancing in public and in the workplace, you must wear your mask. For your face covering and mask, make sure that the appearance meets your department's dress code. If you're not sure about it, if it looks like you got a question, I wonder if this is okay, let me talk to your manager, talk to your manager. But more likely than not, if you've got to ask, it's not the proper face covering. You may not wear a face covering that is excessively large, no ski mask or motorcycle mask, no inappropriate writing or graphics on them. We recommend that all employees self-monitor for COVID-19 symptoms. Again, if you're home, if you're sick, stay at home. We recommend that everyone take their temperature twice a day. You're looking to make sure that you stay below 100.4. Should you have a temperature of 100.4, contact your medical provider. If your symptoms include coughing, difficult breathing, shortness of breath, sore throat, chills, headache, muscle or body ache, loss of taste or smell, please seek an evaluation from your medical provider. As we continue with prevention, social distancing, social distancing, social distancing. Do not be within 6 feet distance of another employee. Wear face coverings, and remember, face coverings is not a substitution for social distancing. Face covering and social distancing. The county has implemented a lot of policies and procedures to try and minimize your exposure. This includes flexible schedules, telecommuting, staggered shifts, and flexible work sites. We've replaced in-person meetings with video or telephone conferences when possible, increased teleworking options. In some cases, it is necessary to modify, postpone, or cancel mass gatherings. Some of your departments have plexiglass installed as a barrier for you. Please, please, please use those barriers. Don't come from behind the barrier to talk to a client. You stay behind the barrier. Maintain the social distancing. You'll see postings in your department, flyers, all giving you guidelines for social distancing, hand washing, cleaning. Please read and adhere to those guidelines. You'll see floor decals and markings to identify 6 feet distance. You'll see this on elevators. Make sure you adhere to those guidelines. You'll have occupancy stated on the outside of the elevator. Make sure you adhere to that. Break rooms, please remember, you must still social distance in a break room. If you do not live in the same household and you're at a small break room table, there should only be one person to a table. When do I self-release from isolation from COVID-19? Remember, if you're sick, you're positive, you've got symptoms, stay at home. On day 10, you can ask yourself, in the past 24 hours, have I had no fever without the assistance of medication? If it's true you have not had a fever within the last 24 hours on the 10th day, then you may self-release on day 11. However, this is if you had a fever, you must stay in isolation. Contact your physician. Please remember, as county employees, some of your positions, we are considered critical infrastructure employees. Therefore, these guidelines will not adhere to all positions. These guidelines are not for healthcare workers. When to seek medical assistance. If you have trouble breathing, persistent pain or pressure in your chest, new confusion, inability to wake or stay awake, bluish lips or face. This list is not all inclusive. However, if you start having these symptoms, contact your medical provider. Environmental cleaning is very important that everyone participate in cleaning and disinfecting commonly touched surfaces. Don't just wait for housekeeping and janitorial services. Everyone should participate in regular cleaning of tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets. No, we don't want you to clean the toilet. That's at your home for regular use, but here at work, it's not necessary for you to clean the toilets. We want you to write down faucets, sinks, etc., high-touch items. Everyday environmental cleaning, your participation will help to minimize the pandemic measures. For more information on COVID-19, please visit the county's website, the county's public health services website, for the Center for Disease Control. In summary, to slow the spread of COVID-19, it is important to do hand washing hygiene, washing your hands for 20 seconds with soap and water. When this is not possible, use a hand sanitizer that contains 60% alcohol. Avoid touching your eyes, nose, and mouth. Social distancing, cleaning and disinfecting. And remember to stay home if you're sick. Now I'd like you to take time to go to both of these websites to review donning and doffing for gloves and masks. Thank you for your time. Stay safe.